We have chosen the healthcare costs in the United States as our health issue. The agency we are referring to is the Food and Drug Administration, known as the FDA, and the key leader we have chosen is Dr. Robert Califf. Background on the FDA, it was established in 1906. It was created as a passage of the Pure Food and Drugs Act of 1906. This was formed to regulate the labeling of food and drugs to prevent adulteration and misbranding. This was at the rise of the industrialization led to unsafe practices in manufacturing and distribution. The FDA's formation was in response to a widespread concern of products having unsafe labeling and the unsafe products being used for the public. Concerns were the misleading marketing in the products that were advertised with exaggerated claims but lacked evidence for their effectiveness or safety. And then the chemicals that were being used in these food and drug products that had toxic preservatives or additive substances used in foods and medicines. So, core functions of the FDA are to regulate food, drugs, medical devices, cosmetics, tobacco, all for the public health issue. Scientific research and standards. It monitors safety and quality standards in the food and drug industries and conducts scientific research to assess the safety and efficacy of the new products. For the purpose of the public health protection, it does protect the public health by regulating and advertising, labeling, marketing practices, ensuring that consumers are not misled or harmed by the harmful substances. It's essentially used to monitor and ensure the safety of public health throughout the regulated substances that are being used. Let's go over some background of our key leader, Dr. Robert Califf. So he was nominated as the head of the U.S. Food and Drug Admin by Joe Biden on February 17th of 2022. He did serve on multiple IOM committees. He was a member of the National Academy of Medicine in 2016. Also served as a professor at Duke University. He is a very frequently cited author in plenty of biomedical science research projects. And he has shown a ton of initiative in solving the problem with healthcare costs. He discusses the problems for rising pharmaceutical drug prices and really makes it a point to bring it to attention and the importance that Americans place on affordable prescription drugs. So remember, our key issue here is the cost of healthcare in the United States. He goes out of his way to recognize that generic drugs are 90% of all the prescriptions that are being distributed, allowing more patients to have greater access to affordable, safe, effective, high-quality medications. While working within the FDA, he has done a lot of work regarding initiatives to improve methods and infrastructures for clinical research. A little more on his values. Dr. Robert Califf is a wonderful example of a key leader and demonstrates many different characteristics it takes to be a successful leader. We found that his strongest traits were his values, his ethics, integrity, and cohesiveness and collaboration. The way he represents the American people and the different drug companies helps him exemplify his leadership nature. Now, going to his values, Americans have the most affordable and accessible healthcare. That is something that he preaches throughout all of his statements about the cost of healthcare. His ethics and integrity that we really found within him was supporting and backing his values when he speaks to the public and his honest communication with the public and just representing the side of the pharmaceutical industry that we don't see very often. As far as the collaboration and cohesiveness, he is known for collaborating with drug brands to make it all work for everybody. So he's trying to find like a happy medium that fits financially for the drug markets, but also helps the United States population. We did find that his negative trait is his lack of desire to change. So while he has done a lot to work within the healthcare industry, he has yet to make a formal plan and make a change for the extreme healthcare costs that we're seeing. With just a plan and getting his administration on board, this would help solve a lot of problems that we're lacking. And this is kind of the trait that we noticed. It's more preach without giving an actual change. So we did find an article from 2008 that states throughout the past 17 years, the cost of healthcare has been increasing and record breaking. Healthcare cost in the US ranges from a primary care visit, it can be lab work, specialty visits, even over the counter medications. Many medical insurance have different requirements, making it difficult for citizens to achieve full coverage. The US is one of the countries that doesn't have universal health care, although it is required for every citizen to have insurance one way or another. In 2023, 92% of the 305 million approximate individuals had health insurance either for some or all of the year. There are options such as Obamacare, Medicare, Medicaid for citizens who qualify. Employer provided insurance is very popular in the United States, or self-pay. The concern of healthcare costs has been an ongoing and important topic in the world of politics, healthcare, and medical professionals. These are the type of insurance that are offered in the United States. You have the fully insured, which is an employer pays a premium to an insurer to cover the employees. Your integrated HRA, which helps employees within their healthcare needs while still offering a group health plan. You have Medicare, Medicaid, which are the government assisted plans. You have TRICARE for people who have served in the military. PPO allows you to see any doctor. You will pay less if you use doctors within the network. HMOs have their own network of doctors, hospitals, and other healthcare providers who accept their insurance. EPO requires you to stay within the plan's network. Point of service is a hybrid between HMO and PPOs. It does have premiums, usually between both of them. Self-pay is patients are just responsible for full cost of their care. So the agency that we chose to assist in the healthcare cost is the Agency for Healthcare Research and Quality. The Agency for Healthcare Research and Quality supports research to improve quality, safety, efficiency, and effectiveness. So their goals are to develop the knowledge, tools, and data needed to improve health system performance and help patients, healthcare professionals, and policymakers make informed healthcare decisions. This agency strives to provide evidence-based information on healthcare outcomes, standards, costs, and access to allow those in critical positions to make more informed decisions that can improve healthcare costs in the United States and improve the overall quality of healthcare services in the United States. A couple of projects that they have participated in was the evidence-based practice centers, and they have also done 13 academic and research organizations that review scientific literature on the spectrum of clinical health service topics and provide evidence in the U.S. Preventative Services Task Force. Both of these projects and this company, this agency, has benefited hospitals, public officials, clinicians at both the state, local, and federal levels, medical school faculties, the public and private insurers, patients overall, which is our goal, and consumers in general. So since this agency strives to provide evidence-based information on healthcare outcomes, we believe that with this evidence-based research and the help of Dr. Robert Califf, they can work together to work on the healthcare costs, but also make it cost-worthy, effective for the drug and healthcare facilities. These are our references that we used as well.